Hi everyone, welcome back to our YouTube channel. So what a treat. Today we are having Mantas Sakalauskas, our plastic surgeon, again, and I know you love him, and today's topic is really interesting, and I believe you will have a lot of use out of this. Actually, Mantas, this is my first meeting with breast implants ever. I've never held them in my life,
so you can hold it now.
Actually, it's pretty awesome. I don't know, it's a bit funny, I have to admit. I feel kind of childish poking them, but they are not easily breakable, are they?
Not very much.
Not really.
No. You cannot break, and you can try this one because you're trying be light.
Okay.
30% lighter.
So can I squeeze like this?
Of course.
What if I break them? Would you be
will
mad?
Not break them. I can try to break them if you want.
Yeah, okay.
But I cannot do that.
Okay, fair enough.
The car can go through it and it will not break. It's hard shell.
Okay.
So yeah, it's not so easy to break them.
Okay. Oh, this one's very soft. It has.
This one is polyurethane.
Polyurethane. Okay.
The coverage of implant is different. It's polyurethane.
Okay. Right. Let's start from the beginning then. Who invented this and when the implants were invented?
So
do you know?
The implants were invented in United States of America, and the date was 1961 years. It was plastic surgeon, and from then you see the implants, they were evolutionized.
Yeah.
Now they are like much better than earlier, but in general they are filled with a similar silicone gel as it was like
Can't
60
help
years
myself.
ago. Yeah.
I have to touch them. It's pretty relaxing because there are a lot of toys for stress relief. Their purpose is to do this actually. Does your daughter have one of stress relief toys?
Yet.
Do you have?
Not yet. No. I don't use them for that.
Okay.
For that purpose, yeah.
You are a pretty calm guy then, I believe.
No, I use them where they belong
to. Okay. So I'm more childish than you. But you are just a little bit older than me, so fair enough, I believe.
A little.
Yes, a little. Okay, so I can see instantly looking at these four gentlemen in here that they are shaped differently. This one is like perfect round. This one looks like this.
Drop shape.
So the term for this one is a drop shape.
Teardrop, you can call it.
Oh, a teardrop. Yeah. Oh, yeah, it does look like that.
But like we are using terminology. Anatomical shape implant.
This is anatomical because the breast itself
imitates the shape of the breast. You can see that the most volume is like in the lower part of the breast.
Yeah.
Like a natural breast where we have more volume beneath the nipple. So here it's like imitate the shape of the breast.
All right.
You can see it here maybe more, this anatomical shape from the side.
Okay. So why do these shapes differ from each other? What is the purpose of the differences? And
so the purpose to achieve different shape of the breast.
Mm-hmm.
Some women they want like more round shape breast.
Okay.
More fullness in the upper part of the breast. So in this case we can choose the round one.
Mm-hmm.
If the patients say that she wants natural look of the breast, we can use this drop shape anatomical shape implant. All right? And also what is different is the height of the implant, also as we call projection, how it looks from the side. This you can see it's moderate projection, this is high projection.
Yeah.
So you can see the difference.
Okay.
If we want more volume, we need to use high profile implant, or if we want very much of a volume, we need to use extra high profile, like ball cut it in two parts.
So actually, my next question is, what does the term high-profile implant mean? Because your assistant Beata always, I can hear her like saying, "Oh, I have the surgery booked for Mantas high-profile implant." So is there a low-profile and high-profile? How does that work?
There is low, moderate, high, and extra high. 4 different profiles. In most cases, I use moderate or high profile. Very rare,
so is
extra
it a
high
size
profile.
of an implant or what?
The height of the implant.
So the height?
Yeah.
Well, so the size basically, no?
In general, not entirely the size.
Okay.
No, not the size, more the shape. If we are talking about the size, we need to consider the dimension of the implant.
Oh.
So, for example, you see the width of the implant, it's like 10 centimeters.
Yeah.
If we have breast width, 10 centimeters, we cannot put the implant with more width than 10 centimeters. If we do like after that, we will see visible implant in the lateral part of the breast. There will be also visible the wrinkles of the implant.
Oh, right.
Okay.
Right.
Yeah. So it will be nice with wrinkles. We call it rippling. And you can see when the women they bend, the breast fall a little bit, and the implant it's squeezed, and you can see this wrinkle. So we cannot choose like bigger implant when there is dimension of the breast.
Okay.
And if the patient wants bigger breast, like for example DE cup, and in most cases we need to use extra high profile. So more height in here. If we have more height, we have more volume.
Okay.
So yeah, it's very important dimensions of the breast and implant.
What is inside of a breast implant?
There is silicone gel. Silicone gel, hypoallergic silicone gel, so the body doesn't react to it very much. The shell also, it's silicone.
Okay.
Shell made from silicone, just much more harder. Okay, but if like the implant is damaged, the silicone it will not go outside of the implant because it's firm. It's not like liquid.
Okay.
Yeah, like in
it's not water.
No. In the United States, it was like this, how you said, filled with water, physiological fluid in general. But here it's like silicone gel.
In terms of the surface, it's not very glossy. It's a bit sharp and like this.
But
Does
just
it have
with
a
the fingers you can feel it. Just with the fingers. If you look from a microscope, the surface it's not regular. It's more soft, as you said, glossy. Now just this like big particles, you can feel it.
Yeah.
But in general, the body don't react very much to it. So these implants were covered with a micro-texture shell.
Okay.
What it means that the body doesn't react very much to it, and complications such as capsular contracture is much more lesser, the risk of that. This is polyurethane. This is different. It's like the foam.
Yes, I've sensed it. It was a bit weird.
It engrows like in the tissue. So with this implant, you see the risk of capsular contracture. It's like very little. They have like less risk compared to this one of capsular contracture. It's like the lesser risk for now in the implants world.
Right.
For this capsular contracture. But what is the problem with this implant? The breast, it's like hard with it for 1 year. And it's very like important to put the implant in very, very like precise position because it will not move. It will not fall again a little bit, not again. So you cannot correct like the position of the implant with like squeezing or the belt top of the breast. So there's some like minuses of this implant. But some surgeons we use it like for primary augmentation. I'm more use of the micro-textured B-light or like this with normal silicone gel.
Okay, so in terms of sizes, what sizes of breast implants are available? What is the smallest size and the biggest?
I can say like in my career, I put it the smallest, it was like 110 milliliters.
Okay.
So very small.
Okay.
And like the biggest was 1 liter, 200 milliliters.
1 liter, 200. It's one implant?
Yes.
So 2 is like 2 liters and
400 milliliters.
And 400 milliliters.
I know the doctors that put a 2 liters implant, one. Yeah. But in general, you see, if you want bigger implant than 1 liter, you need like to contact the manufacturer for that. It's not like daily use, so we need to do like special order for that. We need to do it. But in most cases, you see, in general, like for example, I put like 350, 400 milliliters.
Okay.
And from 300 to 400 milliliters, it's like typical implant. What you need to understand with the bigger implant, bigger problems. Yeah, if we have lesser weight, lesser dimension, there is less impact on the tissue, less problems after that.
Okay. So could you talk a little bit more about the case where you put like these super small implants? Was the difference visible?
It was made with breast lift.
Okay.
So the patient she wanted slightly more fuller upper pole. Not very much like visible, like more natural shape of the breast, just that the slightly above the nipple she will have fullness. So in general she was happy with that, because with small implant it gives impact also to the tissue, and we had after that rounder breast because of that.
So how small was it, that implant, compared to, say, this?
300 smaller, 3 times smaller than this time.
Smaller.
Yeah.
Okay.
So, like I called it, like the tablet of medications.
But I guess it did make a difference, because you lift a breast
Yes,
and
yes,
then
yes,
you
it's
fill it.
like in the volume it looks small, but in general in the tissue it gives the shape, because the patient, she wasn't tall, she wasn't big, so the breast also wasn't big. So in general it like changed the breast position to the better one.
Okay, got it. What circumstances should a person consider while choosing a breast implant size? So we talked about some of them, but maybe we left something out.
So how we can choose the implant? How I said, it's important what patients want, what size they want. So firstly, I ask, what size do you prefer after the surgery? And in most cases, what I hear, it's like CD cup, lesser B cup. And after that, I need to consider, how I said, the dimension of breast firstly, and after that, I need to look in the anatomy of the patient, also in the chest wall, how tall she is, what is her weight. So in general, these considerations, all these things, you think about them, and then you tell patient what you think is the best for her.
Do your patients literally measure these implants, like putting them into bra?
No, don't do it.
It's not accurate?
Not accurate, exactly.
Okay.
Entirely not accurate. Because you need to understand that the implants inside, like the breasts, they like shape different. The breast, when you put on the breast, the implant, it's entirely different. You cannot see the shape. Maybe slightly the size, but it's not very accurate. So maybe for 3 years I don't do it also.
So basically, if I come to you, I don't have to be very literal in milliliters. I just go like, Mantas, now I'm B, I want D cup, natural looking.
That's it. It's enough for me.
Are breast implants, like themselves, are enough for patients who want to have a beautiful chest, or do you perform other procedures related to breast as well?
So in general, if a patient, they come for the breast surgery, for example, so maybe augmentation is third of them. In most cases, also what I need to do is the lift with the augmentation. Some cases also what I recommend to do the fat transfer also with the augmentation. And sometimes you can say that, sorry, but you don't need the implant. You have your own breast tissue and you need maybe the reduction for the better shape of the breast or just the lift without the implant. So how I said, around third of the patients, we had only breast augmentation.
Okay. Should I wait until I am done having children to have breast augmentation?
It's like better to do that, but also it's not like contraindication for the surgery if you didn't have like the baby, because the incision for the breast augmentation, it's above the breast and the inflammatory fold.
Yeah.
So when we put the implant, we don't damage the milk ducts. The gland of the milk, it's intact. So in general, you are able for breastfeeding. Just after the feeding of babies, the breast can be different shape after that.
Mm-hmm.
It can formate ptosis of the breast, and the breast is too low, it's too empty, or it's saggy. So the implants also don't help to avoid that, but also it's not like contraindication, but you will not be able for breastfeeding.
Yeah, got it. But do you know what I'm hearing so far? Actually, there are so much or many variables in this situation. It's always, I guess, best to just go and talk to the plastic surgeon, because there are so many circumstances, and I think I have some things clearer than I did before, but I can see how individual this is. Can breast implants rupture, and what should I do if this happens? Inside the body, of course.
With this new kind of implants also, it's very rare. Mm-hmm. As we did before, you can try it again.
Okay, I will try with more force now.
Yeah, you can try as much as you can. It's not very easy. No. It's not very easy. So this risk of rupture also, it's very small.
But let's say somebody stabs me with a knife.
So yes, I don't say that it's not possible, just the risk is very small for that. But if this happens, the implant must be changed. You cannot walk like with a rupture implant very long, because with silicone gel, it will not leak. It will not be leakage of the silicone gel. Just in general, that when the implant it's not intact, it's damaged. The shape can be different. The capsule can become some irritated also because of that, and because of the rupture, it can a little bit traumatizing the capsule. The implant ruptured. So in all cases, the implant must be changed.
Yeah. But it's not like it starts leaking like crazy all over your body, inside your everywhere.
How I said, it will not leak.
It's a silicone.
It's no leakage. So also you need to understand that around the implant, what's in the body, in the breast formates its capsule around the implant, because it's foreign body. All the time in the body, it will try to avoid this foreign body by formating capsule. And this capsule, it's good for the body, but it don't have direct contact with the implant. And for us, it's good because it's hold implant. This capsule holds implant where they should be, that we would have good shape of the breast.
Okay. Do these have their term of expiration? How long does an implant last in a body? Do you have to change them?
In this case, we have Polytech implant company, so we have 10 years warranty for capsular contracture.
Okay.
What I say for this capsule, that sometimes it will formate, and life warranty for the rupture of the implant. So it means if it will rupture, the implant will be changed by the company. And in most cases, what I recommend for the patient to do once a year ultrasonography of the breast. Just prophylactic thing for that, to look in the breast tissue, in the capsule, and at the implant. If there is no like rupture as we talked, if there is no fluid around the implant, if there is no double capsule, if there is no capsular contracture, if the breast tissue, it also look normal.
Okay, so in terms of nipples being as sensitive as before, how are they affected in breast augmentation surgery?
In most cases they are affected, and in most cases there is less sensitivity after breast augmentation. But also it depends on the shape of the breast, because with different shape there is a little bit different techniques for the augmentation, how much you dissect inside of the breast, how much you dissect above the muscle. And if you dissect more above the muscle, there is more possibility that the nipples will be less sensitive. So if the breasts were slightly more saggy, there is more risk that you will lose some sensitivity. If your breast is entirely not saggy, then it's less risk that the sensitivity will be gone. But in most cases, you see in the only augmentation, there is no like gone sensitivity. It can be lesser for half a year, sometimes 9 months, but some feelings will come back. But if you had less sensitivity immediately after the surgery, so in most cases it will not be the same as before the surgery, but if immediately after the surgery you feel the nipples normally, so in most cases you will have normal sensitivity after that.
Right. Can you breastfeed after breast augmentation?
Only after breast augmentation, yes, you can. If you do the lift, then it's less possibility of that.
Why?
Because we cut the breast gland.
Oh.
After that it heals with a scar, and there is no possibility for milk go through the ducts outside of the nipple.
Okay.
Yeah, so because of that, it can be problematic.
Okay. Let's talk about different natural breast shapes. Let's say my natural breast have a gap between them. Putting this into my breast, how let's say that gap is affected? Do they come closer together or not?
So your natural gap, what you have of a breast, in most cases it's formatted by a pectoral muscle where we connect with just bone here in the midline. So if the gap is bigger, in most cases only with the implants you cannot make it smaller. Because if you try to make it smaller, what can be, you will have symmetry. What it means when the implants will touch themselves, when you have like one breast from two parts.
Yeah.
It looks very unnatural. It's also considering like a complication after the surgery. So what you have naturally, the gap between the breasts, in most cases it will stay the same. If you want to make it smaller, what we can do to do the fat transplantation to that part.
Yeah.
Okay, the fat transfer to make it smaller.
Got it. In terms of breast cancer, if a person has to have their breast completely removed and after some period of time the woman wants to have artificial breasts, is the process of this same as the woman would be with her natural breast?
In most cases you see when there is the case of a cancer, also what can be, it's like chemotherapy or radiotherapy. When you see with that, what can happen, that there is more of scar tissue inside. And in most cases you see you cannot to achieve a good result only with one stage surgery. You can use the fat transfer of the tissue expanders after that, yes, the implant, so it's like more complex thing, and these surgeries we also not easy. All the surgeries it's not easy, just it can take more stages to achieve the best shape what we can achieve to that patient.
Okay. What is the typical healing period for breast augmentation?
The recommendations is typical. You see, 2 months you need to wear special bra, compression bra.
Yeah.
What they recommend also, it's important lymphatic massages, okay, to reduce the swelling because the breast will be swollen for 2-3 months. Okay. The pain, it lasts 1-2 weeks. After that, you feel more like uncomfortable, more like pulling, not like the sharp pain.
Yeah.
So the big physical activities also only after 2 months. So in most cases, like 2 months, you need to have this time out of big physical activities, but like normal house activities in your home, you can do it like after 1 week, 10 days, sometimes 2 weeks. But how I said, not like big physical activities.
Yeah. Is there anything one cannot do with breast implants being in one's chest? Do you have any limitations when you have breast implants? In general?
Now where I'm thinking that I don't see any limitations. With the implant, yeah, it's better not like to run and go to the wall directly with the implants, then yeah, they can rupture, but in general,
I think it's a bad idea without breast implants.
So yeah,
well.
the limitation, like in physical activity, something like that, there is no limitation. Flying, diving, also you can do it without the problem. So I don't see the limitations for that.
Good to know. Mantas, today you have been very generous with your time, coming here and answering
a lot of questions.
A lot of questions, but podcast is what it is. It's a podcast,
yes,
so it's in-depth topic of sorts. So thank you again for your generosity. I think this podcast will be very, very useful for many women, and thank you.
You're welcome. You're welcome. Let's do it. Yeah? And if you want like that.
Yes.
Okay?
Okay.
So thank you.
Thank you, Mantas, and I will put our social media. Mantas has his separate social media accounts on the description box, and social media accounts for wellness travels. So yeah, today somehow I cannot speak clearly today. Please forgive me, and yes, I'll see you next time.
Bye-bye.